Every day in Missouri, quiet battles are being fought. Not in headlines, but in homes, schools, and communities.
There's nobody who on this entire earth who doesn't at some point in time, right, have some type of mental health struggle, right? Does that necessarily mean that they need some kind of intervention? No. But everybody struggles with things over their lives, right?
Trying to start to change strategically that stigma that everyone has on what substance use disorder looks like and who those who are using are portrayed in media, portrayed in everyday life. And so changing that stigma that it's a decision, it's a choice the first time.
I thought that I was only a combination, the culmination, the product of every bad decision that I had made, every poor choice that I had made. You are not just your past. We can start right now in this moment, this second, in rewriting your story.
I never really went to something like an AAU type thing, and you sit around and you hear other people's stories. So I didn't feel so bad for being strung out on opiates, because everybody else, I'm not alone. But I overcame that. It felt good that no one judged you, and you was able to open up and tell your story without being judged and being looked at a certain way.
We really need to start earlier, really need to connect people as soon as possible so they're not living on the streets, they're not living in shelters, or they're not in jail and things like that. And so that early intervention has always been something that I feel like is important. We see that if we can intervene early, then the symptoms that they may experience that lead to, again, homelessness, or they lead to, being in shelters or being in the hospital or any of those kinds of things, they're not as extreme.
I came here from Pennsylvania, was homeless for a while, and then I started receiving services. Within a few months, I had a turnaround in my life where I started loving myself and respecting myself and appreciating myself.
My goal is to meet them where they're at. So whether that's at home, at school, sometimes it's been on the side of the street, going to where they are and meeting with them and helping them in crisis situations, or just sitting with them in their hardest days to provide support and get them connected to the services and the supports that are going to be best fit for them and their family.
Our member agencies are creating meaningful, lasting impact through programs that support mental health, strengthen communities, and expand access to care, helping more people find pathways to improved health, stability, and overall well-being.
Healthcare Home helps because we do the education, especially on diabetes, blood pressures, cholesterol, and when you do that, you extend lives.
Every corner of Missouri, law enforcement officers are trained in the same curriculum, and every officer knows how to respond to a CIT call in the same way. And I can't thank the Missouri Behavioral Health Council enough for all the great work they do, especially as it relates to CIT.
I think the awareness aspect is on us, right? It's on us to make contact with the community, show up to community functions, community resource fairs, talk with the community about, hey, your loved one is experiencing crisis. This service is out there. You can ask for a CIT officer when you call someone, and you're going to get someone with behavioral health experience that's going to respond.
The collaboration is key in all of this, and you can't do a lot of this work, early intervention work or any kind of crisis kind of work or diversion work. You can't do it without strong partners in the community.
Each child and young person that I meet knows that their voice matters. I want them to know that they have a safe space when they meet with me. I want them to feel seen, believed, and supported.
I'm always telling the staff is I don't want them to use stigmatizing language like, here's John again, he's been here 5 times. It's thank God that you made it back. We're so glad to see you. Let's give it, what didn't work? What might work? So that they can make those little adjustments so that they can build lasting recovery, which is their goal.